The most popular plans out there today are the PPO and HMOs.
Right.
What's the difference between the two, and who should be selecting each one of these?
And so that's where the differences kind of come into play. But that's one that doesn't get brought up a lot. Is that
And why doesn't it get brought up a lot?
Because healthcare is not designed for people to know, or health insurance is not necessarily always designed for people to know what our options are. And that's why it's so important to understand the terms. So when you're signing a contract for anything, you want to read the fine print.
And I realize this thing that a lot of people do not know that they're overspending when it comes to their health insurance.
the U.S. spends 2 times the amount in healthcare, and we're last when it comes to access and the outcomes of that healthcare.
I've been noticing that some providers are leaving healthcare.
Ooh. The state of healthcare has to change because we are in a healthcare crisis.
Doctors, welcome back to the show.
Hello.
Hey man, listen. We're gonna get straight into it because if you all don't know who they are, we're gonna put their last show on inside of the show notes because it was a lot of explaining who they are, what they practice, how you can get in contact with them, and we'll put their contact information inside of today's show as well. But I wanted to do this show because, man, I was sitting down with some of my family, some of my friends, and I realized this thing that a lot of people do not know that they're overspending when it comes to their health insurance.
Absolutely.
And one of the things that I'm doing within my new mission, my new assignment moving forward is that by 2053, they say that African Americans will have zero to negative net worth, right? And so my new mission is by 2050, I want to eradicate $1 billion in debt and build $500 million in wealth by 2050. So I got to find all the areas where people can save money, where they can use that money to invest. And one of the key things that I'm noticing is that people are overspending when it comes to insurance policies. And it takes me back to, I remember when I got my first job. And I remember calling my mom and I said, Mom, I got to choose health insurance. And in front of me, I had a PPO, an HMO, a high deductible, Blue Cross, Kaiser. I mean, it was all these things and I didn't know what I was seeing. But my mom told me at 21 years old to get a PPO plan. And at that time, it was $430 out of my check.
Split between the bi-weekly checks.
But I had to spend $35 to go see a doctor. But I only went to the doctor once a year. So I want to have the conversation today, and I want to start up front. The most popular plans out there today are the PPO and the HMOs.
Right.
What's the difference between the two, and who should be selecting each one of these?
So we just want to put a disclaimer out there first that we are medical providers. We are not licensed health brokers or licensed health agents.
Yeah.
So we're giving our perspective and general advice, and we're going to break it down for everyone, but we just want to put that out there just so people know. Always seek the licensed professional when it comes to the best plan for you.
Exactly.
Love it.
So a HMO essentially is, we'll start there, and I'll let my colleague explain. A PPO is a health maintenance organization.
Health maintenance.
Maintenance organization.
Okay.
And essentially what it is you choose a primary care provider.
Okay.
Your primary care provider then will refer you to specialists or other colleagues that you need to go to.
Okay.
But you have to stay within network.
Okay.
So that one has the lowest premium, lowest monthly cost, but no flexibility.
No flexibility.
At all. No. So you want to think about a place like Kaiser.
Okay.
Where they keep everything in-house.
Okay.
And you have to pay a lot more money to go
Outside
of network. Right. So that's an HMO.
Okay.
Right?
Okay.
That's what you asked for earlier.
Okay. And a PPO.
So I like to also just like give a real concrete example of both, right? So HMO, I like to think of it as a dog on a leash, right? Can't go anywhere. The dog is chained, can't go anywhere. So no flexibility.
Okay.
With the PPO, you do get more flexibility. However, you're going to get higher premiums. And that's why it's so important to understand the terms. So when you're signing a contract for anything, you want to read the fine print, because the fine print is where it gets tricky. And so with a PPO, essentially your premiums probably are going to be higher. This means the amount you're going to pay out of pocket every month. Or if you're paying from an employer, how much you're going to pay out of your paycheck every 2 weeks or biweekly.
Okay.
And then in addition to that, you have your co-insurance. That's the percentage you're going to pay. And then the insurance will pay a percentage of that as well. So say, for instance, it's about 80-20. You're going to probably pay the higher percentage, and then the insurance will pay the lower percentage. And sometimes vice versa. It just depends on what tier of the plan that you're in. And then in addition to that, you need to know about deductible, because the deductible is what you're going to pay out of pocket before the insurance is going to kick in. So that means if you go to the ER, you think you have your insurance card, you're going to pull up and they're going to say, okay, you have insurance. I'm covered for all the services here. But then they're going to tell you, you get a surprise bill and you're like, actually, now you have to pay $10,000 because that was what your deductible was, in addition to all the services that you received for that visit. And then the insurance will kick in. So now you're in medical debt. So it's not always black and white, but it's good to understand the difference and compare the levels and tiers before you make a choice.
Hey, what's going on, fam? Real quick before we get into today's show, I need your help. You see, over the last 4 years, this movement has grown by over 1 million people. And to be honest with you, we are just now getting started. So to serve you better, yes, you, my team and I have created the E3 Impact Survey. It is a short 10-minute survey to learn more about you, your money goals, your general goals, your struggles, and how we can support your journey to financial freedom, which is financial wealth, right? So our mission is 100% in the super bold here. This is to help eliminate $1 billion in debt and build $500 million in assets by the year 2050. But we can't do that without hearing from the people we're here to serve. So, to thank you for taking the time out of your day to complete the survey, we're giving away 4 $500 Amazon gift cards. Just complete the survey and you'll automatically be entered into winning. We'll email the winners on June 15th. All you have to do is to head over to anthonyoneal.com/survey or click the link in the show description to take the E3 Impact Survey. Listen, your voice is crucial. Your voice is key to helping millions and building the future we all deserve. I want to ask you this because when me and you were talking, we were talking about different tiers, and I don't understand that because I have a high deductible plan. And I'm curious, and I got my plan through the marketplace. Right. And so when you said tiers, I was like, but dang, do I have the right plan with the right tier? So can y'all explain to us the different level of tiers that comes inside of our health insurance plans?
Yes, so there are 4 major tiers within that health plan that you can choose from, right? And you really want to base it on the cost sharing between you as the insured and the insurance company.
Cost shared is what I pay and what they
pay. Right, the percentage that you pay versus the percentage that they pay.
Okay.
So you have the bronze plan, which is a lower plan. Okay. And the insurance company covers about 60%.
60%.
And then you pay about 40%.
Okay.
So I like to think about that as like the fast food plan, right? We're going to try to keep it in layman's terms.
Yeah.
I like that.
And then you have the silver plan, which covers about 70%. They cover that. And then you pay 30%. So you think about that as casual dining. I'm going to Chipotle. I'm going to Meze. I'm going to Cava, right? Then you think about the next layer will be the gold standard plan, right? And so that covers 80%. That's what they pay, and you pay 20%.
Okay.
That's more of an upscale bistro.
Okay.
Okay?
Okay.
And then you have your all-inclusive resort, the platinum plan, where they cover 90%. And you pay 10%.
Okay.
And that's all you pay. Okay. So that's like the VIP ultimate standard. And so those are the 4 tiers based on cost sharing underneath those HMO, PPO, and there's even some other ones that we're going to discuss.
So if I
co-insurance, that's not all the other terms that we talked about. And also just want to mention too, there are other websites that you can look at aside from the marketplace that are going to tell you how to compare those plans.
Like what? I'm going to write it down.
Policy Genius is a really good website.
Policy Genius. Okay.
There's Fair Healthcare Consumer.
Fair Healthcare Consumer. Okay.
There is Healthcare Blue Book.
Healthcare Blue Book.
KFF.org.
KFF.org.
Yeah. And as Dr. Thompson mentioned, healthcare.gov is always...
Healthcare.gov.
Healthcare.gov is where I went to.
The marketplace, right? But it's a good place to start and then...
Okay. And these websites, and we're going to link these inside of the show notes, you all, so that way you have the proper links. But these websites will help you understand what's the best policy and really break it all down for you.
Yeah, and compare. Because, I mean, you need to understand that comparison depending on what your priority for your health insurance is. Are you the single person or are you the solo entrepreneur? What do you really need? Or are you a family of 4? Because that's going to differ based on what plan you need, right? We all don't fit in the same box as far as health insurance is concerned.
This is good.
So this is the information that we need to understand how to break down which plan is going to be best for us.
Okay. What's going on, fam? Hey, listen, if you're serious about getting out of debt, building real wealth, and creating a life of freedom, this is your home. I want to personally invite you to subscribe to the channel right now, because every single week we're dropping videos that will help you take control of your money. It will help you shift your money mindset and break money generational cycles. You see, this channel isn't just content. It's honestly a movement. Over 1 million people have joined this community over the last 4 years. I'm still blown away by that, to be honest. And our mission is bold. It is to eliminate $1 billion in debt and build $500 million in assets by the year of 2050. We talk real money, real freedom, and real legacy here at the table. No fluff, no credit card hacks, just the truth that will set you and your family up for a better financial future. Do yourself a favor and join this family, join this movement by hitting that subscribe button. Turn on your notifications and join this journey, because this is where financial freedom begins. Let's get back to the show. Hit that subscribe button. As doctors, not as licensed insurance agents, I want to say this, I'm trying to cover you all, to cover me too.
Yes.
I want your thoughts, not your legal advice. Okay. You have a single woman,
Right.
no kids.
Okay.
She's healthy.
Yeah.
I think as a woman, correct me if I'm wrong, okay, if her husband is in the building today, so he could probably answer this because he lived with her. But you know what I'm saying? I think, ladies, y'all have 1 or 2 suggested visits a year that y'all should do every year.
Exactly.
And that's called a maintenance preventive thing. We have 1.
Right.
Right. And so if, let's say she's healthy and she's doing those 2 things, and she comes to you and says, hey, sis, I'm about to talk to an agent, a licensed agent, but what would you recommend this healthy, young, vibrant lady with no major medical, should she get an HMO, PPO, bronze, platinum? Why are you looking like that?
So I would recommend a high deductible.
Come on now, talk to me. Yes, ma'am. Yes, ma'am.
Just because you're saying, right, you broke it down for us. She's single, no kids, and not many medical problems.
Yes.
Right? And so with a high deductible health plan, if anybody doesn't know out there, you have a very high deductible, anywhere from $3,000 to $7,000.
Talk to him.
What Anthony's is.
Yep.
And you have to reach that deductible in order for the insurance company to then cover you. But if you're relatively healthy, you shouldn't really be reaching that deductible, because in addition to your high deductible plan, you also have a health savings account, which you are putting money into every month yourself.
Yes.
And your employer is then putting money in every month.
Yes.
That is tax-free.
Yes.
And the investment that you put it in is also tax-free.
Yes.
And then when you go to take it out, it's also tax. Yes.
I just did it this morning. I got a crazy earache, y'all, and they're my doctors, and so they have me taking some medicine, and I DoorDashed the medicine here, and I was able to use my HSA card. You know what I'm saying? I was like, that's tax free.
But the key with that is saving, right? You have to save to prepare for the catastrophic thing, or for the acute illness. You gotta save for it.
Okay. All right. So let's add to this level, right? She has a child, but she's healthy. Baby's healthy.
Game changer.
Do we still do a high deductible plan?
No, because that baby is going to need more frequent visits, right? Because there are certain visits that you need as a child that are recommended, especially vaccination. So if you're going to be going to the doctor more frequently, a PPO would be more of a beneficial plan. And also, one thing that I'd add, Anthony, is considering whether she works full time and she's getting insurance from her employer, or if she's getting insurance on the marketplace, because that's
she's full time.
She's full time. Well, she's typically they're going to offer you the 2 types of plans: the HMO or high deductible plan, and or a PPO. So PPO would likely be better for her because she has a family. You want to protect yourself and your child, and you don't want to be in a situation where you're in medical debt because you didn't invest in your child. And think about protecting them for anything that could occur in addition to illness or just regular maintenance.
Okay.
60% of bankruptcies are caused by emergency medicine visits.
Yes.
Right?
Yes.
Because those visits cost about $2,500 to $3,500, and people can't keep up. In addition to paying their regular medical bills, can't keep up, and then they have to file bankruptcy.
Yeah.
A lot of that is due to medical debt. Right? And so choosing the right plan, as my colleague said, with the child, you would want to do a PPO.
Okay.
But there's even another plan called a POS.
POS.
A POS plan.
Okay.
And in that plan, it's a point of service plan. And what it is a kind of a mixture between an HMO and a PPO.
Okay.
And essentially, I will give you an example. Let's say you're a father and you have one son that goes to college, right?
Yeah.
And you're here and he's in Atlanta. Right? And you want to stay in network, but you also you have type 1 diabetes, and you're like, well, when I go visit my son in Atlanta, I want to be able to see an out-of-network provider in Atlanta, right? While also still having my in-network people in DC.
Yeah.
Okay, so the POS plans, the premium is a little bit higher, but you at least get options to be able to go out of the network that will be cheaper than doing a PPO. But that kind of goes to like you having obviously an older child, like a college age child, and then a younger child that may break their leg, needs to go to the dentist, have all these illnesses all the time, as everybody knows with kids with daycare. And so that's where the differences kind of come into play. But that's one that doesn't get brought up a lot. Is that POS plan.
And why doesn't it get brought up a lot?
Because healthcare is not designed for people to know, or health insurance is not necessarily always designed for people to know what our options are, right? It's designed, unfortunately, the harsh reality is for us to be in debt. I mean, when you think about the cost, the average cost of healthcare for an American, for a family, it could be about $32K a year. And I mean, that's just baseline. That's not talking about the services that you're receiving. In other countries like Japan and Germany, it's not that expensive because they're going to the doctor about 13 times out of the year. That's the normal. We're going under 3. So, we have to really start thinking about what other countries are doing too, because that really is important as it relates to how much we're spending per capita and why. Because we're not using our resources, or we're overusing our resources because we have chronic conditions and we're not managing them on the front end.
The U.S. spends 2 times the amount in healthcare, and we're last when it comes to access and the outcomes of that healthcare. Think about, we're a developed country. We say we're number 1, right? Which a lot of people would debate on now. But yes, twice as much in healthcare, like she said, the GDP, right? Finance guy,
Yeah.
But the lowest in access and outcomes.
One of my goals with you all is, for me personally, is that I would like to get to a point to where I can see Dr. T at least once a quarter. One of my friends, he's super wealthy. He sees his doctor every other month.
Exactly.
And I'm like, why? I said, bro, you just saw him the other month. He said, bro, I can see him this month, but in 2 weeks, something can start forming.
Correct.
And he was like, and if something started forming, if I caught it a month and a half compared to a year later, that goes from just me taking a pill maybe to a major surgery.
Correct.
And I was like,
perspective.
Yeah.
Whole nother perspective.
Yes.
And then so now, what I'm saying, I go to the dentist once a quarter now to get my teeth cleaned. I want to keep them white. And I think last show, you all educated me on why.
It's so important.
That is important. But we don't have this information, right? And this is why I really wanted y'all on the show, because I'm like, man, this is hurting people. This is keeping people in debt. This is causing people to file bankruptcy. This is causing people to not be able to invest because they got to take care of their health. And I'm like, if this is important, which y'all, they probably don't like me to say this, but they working on the show. And so we're going to have them on the show once a month over here, because I really do believe health is attached to your wealth. And so we're going to try and get them on a show to where they're dropping a show at least once a week. Because, man, hey, let me just say this, too. Her husband here, I already said this, too, so I won't feel bad. And Dr. T's fiance is my man. Man, listen, brothers, our intimacy life is being impacted because of this gut, especially when it comes to Black men. And so I'm like, yo, I don't want to get to an age. I don't want to be at 50, and I want to be sensitive in what I'm saying, because I know some of you all are watching this right now who are older and you're going through issues. But I don't want to get to that age with me having access to this information and not make the right decision that will impact me and my wife's relationship. It could impact me being a father because I may not be here long enough, or I may not be able to do certain things. Or watch this, I got to worry about my health rather than worrying about building more wealth.
Yeah.
Right.
And so I'm like, man, and this is not an attractive, sexy subject.
No. It's a harsh reality.
It is, you know, and I'm like, every time I talk to y'all, I just get like, dang, man, I got too bad.
And it can be overwhelming. But 88% of people, like our age and out there, do not understand basic things like deductible,
Basic,
copay, co-insurance.
Exactly.
But you gotta at least understand those terms
basic.
to be able to make like an educated decision about which plan you should choose in your enrollment period. Because we haven't even talked about that.
Open
And
which is like the Hunger Games.
No, we're gonna talk about that. We're gonna talk about that because I think it's so important. I remember when I first got my high deductible plan. I remember telling y'all this, and I was like, man, I am the money guy, and I didn't know this. But it's like, so I got the high deductible plan because I'm only paying $98 a month for my insurance. But my deductible, correct me if I'm saying the term right, is $7,000.
Right.
Meaning that I have to cover the first $7,000 cash out of pocket before my insurance kicks in. And my insurance kicks in at 70/30. So they pay 70, I pay 30. Well, I went to the doctor's office, and because I knew that I had to pay, right? I didn't give them my insurance card because I was like, well, I got to pay the first $7,000 anyway. This is only going to be a $300 visit. And it's like, boom. And I wasn't keeping track. So then I went back to the same doctor. This is when I was living in Nashville. She was like, hey, Anthony, do you have an insurance card? I was like, yeah, but I got to pay for it. She was like, no, son, give me the card.
Right.
You might
I was like,
$1,000 you didn't even know.
Yeah.
Right. And so she was like, you have to, every time you come, because that's how they track how much money you're on. You can't call them and say, yo, I'm at 7,000 when they don't know that. So we got to report it. Then she was like, and then when you're coming, do you have an HSA card? I was like, I think I do have that in the mail at the house. She said, poor baby. That money you put in the account, you can use that to pay for your medical time when you come. And I was like, word? Like, I was only investing it.
Right.
I didn't know I can use that Visa card for anything around my medical bills.
Yes.
Yep.
And so this is why, like, I just think that you all got to come in and watch this. And y'all said it. Because I want to talk about the employee who are the average person watching. Then I want to come over because we have a subsect of people who are like me.
Business owners and freelancers.
Yep.
Yeah.
And finding insurance for me was very difficult.
Yep.
Because I didn't know where to go.
Start.
Right? And so, but let's come back over here to the employee. Open enrollment time.
Oh, Hunger Games.
It is, right? What are the things that, what would you say that the top three most important things to know? If there's 5, give us 5. But what would you say the top 3 things that we need to know during this season when it comes to open enrollment?
I would say number 1, knowing when open enrollment season is. Open enrollment season is from November to about January.
Okay.
But also, it also depends on qualifying events where you can join other times of the year. It also depends on if you've lost your job recently. Those things also qualify in open enrollment. But more specifically, open enrollment is typically between November and January. So before that time, you should be budgeting. That'd be probably number 2, to figure out, okay, when I look at the marketplace based on my zip code, because that also matters, where you're located. Your rates are different. But yeah, when you go in the marketplace, you have to put in your zip code. That's because the rates are different.
Here is the truth. I am always looking for practical ways to help you build, wealth, specifically generational wealth and legacy. And one of the best ways you can do that is with life insurance. That's why I've partnered with my friends at Ethos. They made buying life insurance simple and hassle-free. Whether you're the main provider for your family or want to make sure your loved ones aren't left with financial burdens like debt, life insurance is a powerful way to provide financial security. As a business owner and a homeowner, I took this seriously and secured a $2 million life insurance policy through Ethos. Why? Because having a peace of mind, knowing my family will be cared for when I'm no longer here, is extremely priceless. What I love about Ethos is their quick and straightforward process. You can apply entirely online in as little as 10 minutes. I'm not even exaggerating. I did it myself. Listen, no medical exams, just a few health questions that you must answer honestly. Plus, it's affordable, making it easier to protect your family without breaking the bank. Listen, I want you to lock in your rate today by visiting anthonyoneal.com/life insurance or click the link below to get your personalized free quote today. Listen, as we're getting back to the show, I want you to protect your loved ones. Don't play around with it. Be like me. I promise you. It's a hard conversation to have, but you will sleep peacefully knowing that you took care of your family. Go to anthonyoneal.com/life insurance. Let's get back to the show to help you keep building this wealth.
See, it's the sneaky, tricky things that you don't know that are going on behind the scenes. But essentially, you need to know what the comparisons are so that you can prioritize what's important to you. Which category do I fall in? How much am I going to use the services? So then I can budget and plan for that open enrollment period. And I have my money prepared for when I'm ready to sign that contract. And then read between the fine lines. Know the terms and understand what those terms mean so that you don't sign a contract that doesn't align with your priorities for your health.
Yes. People don't always think ahead, and sometimes, you know, in that open enrollment period, you want to make sure, like, if you're a woman and you're like, okay, me and my husband are thinking about having a baby, in that open enrollment period, there are certain questions you should be asking. You shouldn't automatically go to the cheapest option. 93% of people will re-enroll into the same plan and not even look at the other options. Like, possibly saving them money.
Yeah.
They just automatically re-enroll because they don't want to take the 20 minutes to educate themselves on the different plans that are out there and how those life changes, preemptively thinking about those life changes can affect the type of plan they use. Like you said, a single person with no kids who may be an employee versus a person that may have a family that's employed somewhere. It's going to look different.
Also think about age, right? Because at different age groups, you're going to have different screening and testing that's recommended for you. So maybe you're younger, you don't need as much screening and testing, but as you get older, your thought process should change as far as, okay, I'm going to need to see the doctor a little bit more regularly, especially if you have a family history of cancer or family history of other chronic diagnosis or prognosis are poor. You want to think about that family history. We don't talk enough about our family history in our families, but we should, because it's very important to understand as far as how our outcomes will be later on in life.
No, that's real. I think when I first got connected with y'all, I had a conversation with my parents. So I need y'all to tell me the truth. You know, on one side of my parents, diabetes is real big. On the other side, prostate is real big. And so it was a very hard conversation.
It is.
To know that, okay, diabetes on one side, prostate on the other side. Jesus. And that's a lot.
It's tough.
You know, but the spiritual side of me kicks in. People perish for the lack of knowledge.
Right.
And I think that a lot of us are perishing or getting sick. And I'm just saying the truth, because we are fearful to get the knowledge. Once I know what I can possibly face, I know how to possibly prepare for and attack it ahead of time.
Yeah.
And I think Black people, we just got to get better at that, y'all.
It's like having on the armor of God, right? When you have that armor on, you're protected.
Yes.
You're walking to the battlefield, because sometimes walking into these insurance plans could be a battlefield, signing those contracts, but you're prepared.
So we talked about the employee. What about someone like me who is self-employed? And for me, it was difficult to find good quality health insurance. And to be honest, listening to you all more and learning more about it, I may need to go back and do some research myself. Just to be honest and transparent.
So a comparison chart.
I mean, I'm paying $98.
Right.
My deductible is $6,000, right? But I'm like, do I have the right plan? After listening to what you all have been teaching me over the last couple of months, I'm like, okay, this season, when it's enrollment season, I'm going to do some real good research between now and then. And I may be going back to change it. But what do you all recommend? Ooh. Now, I didn't prep y'all on this one. So if y'all don't want to answer, don't answer. But there's these insurance companies out there that are saying, hey, you might not be able to afford this insurance company, but come over here into this company. I forgot what it's called. It's like a Christian health insurance company where you donate money in and then it's like it's a big pool. And if you have something, then all that pool goes to you.
Right.
What is that called? And would you say that is a legit option out there?
It's a form of, so let's take a step back. So there's something called direct primary care, which is what you're in, has entered into with me and Dr. Thompson.
Yeah.
In which, if people don't know out there, it's essentially where you're paying a membership every month.
Yes.
We're not billing your insurance.
Right.
Which is different from concierge, which is like an MDVIP,
Yeah.
where they bill your insurance and then also charge you an annual, monthly, yearly membership. Right? The Christian plan that you're referring to kind of comes alongside the direct primary care concierge route, where it's another cost sharing benefit type situation, as I explained earlier.
Okay.
So it's another pool of money that somebody who has a plan that's affordable, like a DPC plan or a concierge plan, their physician can tap into that money for them.
And you're going to see these companies popping up here. Every time I go and I'm researching for myself, I find companies popping up here and there, whether it's concierge, direct primary care, and you're seeing what they're providing for patients. I mean, the state of healthcare has to change because we are in a healthcare crisis.
Yeah.
We don't talk about it enough, but we are. And so with that state, we have to provide more resources for patients to be able to access care. That's kind of going into the access. And for the people that want to invest and prioritize their health, then they're going to invest in plans like that so that they're going to be able to have coverage outside of their employer if they are a solo entrepreneur.
That is good. Now, if they don't do that in plans like me, what would you all say? Is it going back to what you all said earlier? Because I went to healthcare.gov to get my, to the marketplace.
Right.
And I mean, it's pretty decent. I mean, but here's the thing, I haven't really used it.
Right.
Because I've just been paying just the monthly, just to have it.
Just to reach the deductible.
Yeah, just so
Right, just so
catastrophic,
deductible.
basically, so that way.
Right. Definitely. But as I'm getting older, I'm 41 next month. Should I be looking into something different at this age of my life?
I think you should optimize your plan based on your age.
Okay.
Absolutely.
Okay.
Because your screenings are going to change.
Yeah.
You're going to start needing a colonoscopy. You're going to start needing more frequent prostate evaluation.
Yeah.
And unfortunately, as we get older, life starts to hand us some things.
It does.
You know, the other day my hip was hurting and I'm like, oh, what's this? So you start to get some surprises as you get a little older. So being prepared again for it is important.
Okay.
And how flexible you want that to look for yourself, right? Like if you want a specialist that's outside of a network that you're being referred to, that would also guide what type of plan you use. Like she was saying with preventive care, colonoscopy, there might be a specific type of GI doctor that you want to go to that might not be in the plan that's in your network. So then you want to look at something like the PPO, as was mentioned earlier, or even something called an EPO.
Ooh, see, you keep bringing you brought up POS earlier. Now we're going to E.
I'm trying to.
Alphabet.
Yes.
What is
the
EPO?
Exclusive Provider Organization.
Right.
Okay.
So that's a little bit of step down from a PPO, where you're still in network, but you don't have to go through your primary care doctor to get a referral.
Exactly.
Wow. Okay. For the how do I say this correctly? For all of us newbies who don't understand this, you all keep saying something. I felt someone in my community saying, wait. What do they mean go out of network? So if I go out of network, are you all saying that I got to pay for 100% of that visit?
Yes.
100% coverage to see a provider that's not listed in the doctor's profile that's provided for you.
Oh, crap.
Yes.
I know that, but that's a lot of money.
I'll give a real world example. A lot of ladies are going through a lot of fertility issues right now.
Yeah.
Okay. And so it's like, okay, that my doctor gave me these in-network providers, these
Yeah.
in-network GYNs, Shady Grove, and there's a lot of other, fertility places in DC.
Yeah.
But I want to go to this particular doctor over here who has a high success rate of pregnancies.
Yeah.
But that person not in my network. Now I have to pay completely out of pocket for that doctor, where I wouldn't have to before, depending on what type of plan I chose.
Your health insurance is useless.
Right.
Health insurance is useless. But this goes back to what you all said earlier. Between now and November, it sounds like, correct me if I'm wrong, we need to be writing down our medical stuff that we know
Priorities.
that are priorities. Me and my wife, we want to have a baby and we're having fertility issues.
Right.
Write that down. I'm turning 41 and my primary care doctor says, yo, you got to start having, screenings. I got to write that down. I've been having this. I got to write that down. And then you write it down and then do research on doctors who may be outside of you all that you may want to go to and see and write those doctors down and then see where those doctors are within the plans that you have.
Correct.
Absolutely.
That's
Which is individual, as you just mentioned.
But when you're planning for your future, you invest that
That's what you
time.
do. This is why they need their own show.
Take 30 minutes. Just take 30 minutes and go sit down and
like
Google the
more
chart.
than 30 minutes, doc.
I know. I'm just saying,
Start there.
start there because I feel like people get overwhelmed.
Yeah.
And once they get overwhelmed, it's like, oh, I'm just going to choose a plan.
Throw it out.
Just choose whatever plan. Just
But we can't afford to do that, though.
call us, guys. You can come to us, obviously, but you can go to your primary care doctor and literally say, hey, I'm in open enrollment. I have my patients do it all the time. What plan do I need? You know my chronic conditions.
Wow.
What do I really need?
Right.
And something that me and Dr. Lewis were talking about is being able to actually help patients navigate in other states how to find those direct primary care or concierge specialists, because sometimes they're not always easy to find. So that's something that we're currently working on, maybe trying to build a platform around that. There are a couple, but I don't think they're well known. And I think having that awareness and knowing where they are and how to access them, because we got a lot of feedback from other patients in other states, like, we'll sign up. And we're like, well, unfortunately, we don't practice in other states. But what we want to do is pretty much kind of start delving into that space, because it's so important to have access to where those providers are located.
Yeah,
y'all. Listen, we're going to link their last show inside of today's show notes. They are my primary care doctors, and they serve the DMV area. So that's DC, Maryland, Virginia. I think there's one more state too, right?
for me. Florida.
Florida. And so if you're in one of those 4 states, reach out to them. I'll let y'all explain. I got like 3 more questions I really want to ask that me and you talked about earlier. But exactly what does you all's service provide in the DMV area?
Okay. So as I explained, PatientWell Connect is more of a direct primary care, self-pay telemedicine service, which is an alternative to a lot of the things that we've been mentioning earlier. But it's affordable without insurance. And what it allows the person to do is to pay a monthly membership to see us 2 to 3 times a month, whether that be telemedicine, at home, right? Call, messaging your provider to get that basic routine care done, right? In addition to having some type of catastrophic insurance. Because we would always recommend that, because anything can happen. You can fall and break your leg.
Facts.
Now you got a fracture and you got to get surgery, right? But this is for routine care, for you to have a continuity of care with a primary care provider for preventive services, labs, and those things to help, like you said, health is wealth. It starts there at that primary care side. And this is just an alternative to provide that care.
Man, no, I love it. I love it. I think when that call you got, it was yesterday.
Yes.
I think I texted her like at 2 o'clock. You're like, yo, my ears are killing me. And she's like, all right, I'll see you at 3 o'clock. And then boom, she gave me the medicine and boom, 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 boom. And what I like about it is you all educate on what's happening, and then you all try to do the safest thing for the body.
Exactly.
Not just give me medicine.
Right.
One thing I would definitely say, and this is why I'm saying I think y'all need to check it out. So Doc, she said, hey, I would put you on antibiotics, but we just had you on antibiotics like maybe about 6 months ago on something else that I was going through. And she was like, so I'm not going to do that. And she educated me on why we're not going to do that. And I was like,
Yep.
wow.
Yes.
No doctor has ever asked that question that I've been to. Hey, when is the last time you've been on antibiotics? Not one doctor. I'm 41. Not one doctor has ever said that. And when you said that, I'm gonna find I was pissed. I'm like, because she was like, so because if you do this and your body is gonna be relying on that, and it's not gonna keep its immune system, strong for it. Yeah. So I was like,
Yeah. It's called antibiotic stewardship.
Exactly.
And people can
antibiotic stewardship.
Yeah, it's something that's changing in healthcare right now, because we overuse antibiotics for a plethora of bacteria. And sometimes even viruses when we don't need it,
Right.
common cold.
Right.
And so with that, we're trying to be better about prescribing or over-prescribing antibiotics so that we don't become resistant to those same drugs where we can't use that medication to treat that bacteria because we only have a limited amount of antibiotics that fall into different groups depending on what type of bacteria it is we're trying to treat. So imagine we keep shelling it out like candy, your body's gonna be like, okay, but then the bacteria is gonna be like, well, I'm smarter than that.
Right.
They start to replicate differently, and then you're not gonna be able to overcome that respiratory or bacterial illness because we've overdone it with antibiotics.
Also, going back to the gut health thing you mentioned earlier, antibiotics destroys that. And so it causes something called Clostridium difficile infection, where it's a constant diarrheal infection that can cause sepsis eventually.
Okay.
And it starts from certain antibiotics.
Yes.
So that's why we have to be so diligent in our recommendations of antibiotics and when to use them, the duration of them, when they're needed, when they're not needed.
Yeah.
Because that's a even severe outcome that can lead to death, actually.
Yeah,
Wow.
MRSA. MRSA was a big thing. It's gotten better, but MRSA was something, it's like skin resistant. So we were treating with antibiotics for skin conditions, and then again, the bacteria get smart and they're able to replicate and not fight that with that particular antibiotic anymore. So then now you get resistant, and we have to find different drugs to treat that particular bacteria.
So we're gonna drop the information inside the show notes. I need y'all to check them out. If you're in the DMV area, y'all check them out. Sign up. They are affordable now. When I say affordable, this is what I mean as far as an affordable now. You know what I'm saying? Like now, you know, these ladies are gonna blow up even more, and prices are gonna have to go up for sure. But I'm like, for me, what their fee is, as I've matured and evolved, that's an affordable price. Because what they're charging me on a monthly basis is what I spend on food. That's what I'll spend on going on a date. That's what I'll spend 10 times more than that on a vacation, right? So for me, I'm trying to live as long as I possibly can. And so we're gonna drop PatientWell's information inside of the show notes. Make sure y'all check it out. I sign up with them and I use it. I don't hesitate to text at all because I want to make sure that I last as long as I possibly can. But I do have another question, 2 more questions before we end the show. I've been noticing that some providers are leaving healthcare.
Ooh.
And it's concerning to me as someone who's not in y'all's field. Like, why?
Yeah. We talked about this before. Burnout is one phenomenon where you're seeing so many, health insurance kind of drives that. So, you know, insurance is the middleman between the doctor and the patient. And sometimes we don't really agree, right? And so with that, doctors are now having to see 30, 20 patients a day. You're working 5 days a week, a day. You imagine you have patients, maybe 7 patients on your schedule that have chronic conditions, and you're trying to manage that in 10, 20-minute visits. That's just not enough time. Why would anybody go to medical school, go to nurse practitioner school, be in healthcare, and sign up for that? That is ghetto.
I always tell patients, like, I didn't go to school to be a secretary, and they always laugh, but it's like the administrative burden is so cumbersome. Like Dr. Thompson said, with the insurance companies, so you're fighting the insurance companies as a provider, and then you're also dealing with the administrative burden, right? 1 in 5 providers experience burnout. 71% leave. They mention administrative burden as the reason why they leave. And so that's where these DPCs and concierge medicine practices are starting to pop up to try to give some resolution to that problem, because we're in an extreme primary care deficit in this country.
Absolutely. There's
And,
like
you know,
7,000, over 7,000 for currently for the shortage of providers in general. And by 2040, it's going to be about, or 2036 actually, it's going to be at about 40,000 for a shortage of providers in general. So imagine now, you're going to have to probably wait 30 days to get in to see your provider. You're not going to be able to call and, hey, I need to be seen, or pull up to the emergency room and maybe wait 10 hours. You're going to be waiting longer because there's not going to be enough providers to see patients. You're going to be waiting. You may have a broken toe and you're not going to be able to see the doctor, unfortunately, because there's not enough providers to cover all of the patient care. And as we continue to leave practice, you know, for us, we decided to make a different decision. And we continue to encourage other providers to make those decisions based on what you're seeing in healthcare. We have the seat. We can make changes based on what we see. We don't have to allow policy and capitalism to decide for us what healthcare looks like, because we went to school, got the degree, and decided we wanted to help others.
Because the first people it's going to affect is our communities.
Facts.
Exactly.
You know,
Facts.
we throwing out these statistics, and I hope everybody really paying attention. It's going to affect us first.
Yes.
And as I mentioned in the last, the last segment, metabolic syndrome,
Right.
and I got it off all, is what affect our communities first. This lack of primary care
Yeah.
and people of color providers.
Yeah. No, we need more people of color providers. You know, and I mean it. We need more people of color who have the information and who's willing to help teach and provide that information. You know, one of the main reasons I left my previous situation is because I wanted to speak more to people of color and help my particular community. And I'll be honest with you, I don't have no problem. I'm not racist at all, but I'd rather see a black doctor than a white doctor. I'm just gonna be honest for me, right? And so I'll never forget when I first met you and your fiance, she was not even in the room. Her fiance was telling her, he was just like, yeah, you know, my wife, she's a doctor, she just started her own business, and you know, they're a provider, private, like executive type. I was like, word? So I didn't ask, but you know, I didn't see you, and so I was like, is she black? You know what I'm saying? And then when you came, I was like, she black? Oh yeah, bro, sign me up, because it's like you just feel comfortable because I feel as if we just know a little bit of our community, what we're battling, what's going on. Not saying that white doctors don't. No, I'm not gonna say that because they should be educated just as much. But I think we just relate better.
Yeah.
And there's unfortunately that sometimes black people are more comfortable with black people.
Yes.
Fair.
And so I want to highly encourage you all to check them out. If you're in the DMV area, please do. If you're out of the DMV area, send them a DM and say, hurry up with your show. So that way I can know what to be asking my provider, how to do the proper research. I've been asking them, you know, hey, y'all should do like a call-in segment too, to where y'all can call in and get some non-advisor advice, right? This is just a suggestion. This is what we would do if you were our provider, but again, you got to go to your provider. So we want to make sure that we set them up legally to win. But I think that is a good option. But we got to make sure that's legally covered because, you know, I don't want them sued because I love my doctors. I love my doctors. And so tell them hurry up, launch the show because they have a lot of information. There's a lot of information that we just need to know about.
Yeah, we can't cover all of it.
Not in one segment. No. All right, let's end the show with this one. The elephant in the room.
Ooh.
The elephant in the room. Recently, we saw the CEO, United Healthcare, Brian Thompson, unfortunately passed away.
Very unfortunate.
How did that impact the healthcare industry?
Look, we don't condone any violence by any means. Everybody deserves respect and deserves their life and not to be taken away. But it illuminated something that's wrong. We said this, it's the healthcare crisis. It's the access. Elizabeth Rosenthal, she's an American physician, and she's also a writer and an advocate for healthcare. And she wrote the book, An American Sickness. And what it does is it continues to illuminate the problems in healthcare, the access to resources, the profit over patient, the fact that healthcare is not the norm, it's a luxury, it's not equitable across the board. There's so many disparities. And she talks about that, but she also talks about what we can do differently and how we can advocate for ourselves and how we can be knowledgeable. And when we educate ourselves, we're able to make that different choice. Unfortunately, tragedy sometimes happens so that we can make a change. It's unfortunate, but the good thing about that, what comes out of that is that knowledge and the power to do something different.
Yeah. I think with that situation, it woke a lot of people up and it made people, to me, get actually more educated. Right, and you had you see different responses to the situation. You had some people that were very sympathetic. Some people looked at it as symbolic, because they looked at it as he represented a bigger system that's corporate rich. Right, very unfortunate what happened. But we need to start taking a bigger look. I think it is causing conversations like now, and not just it's happening in people's living rooms.
Yeah.
People are having it on social media.
Yeah.
We're having it in podcasts,
Yeah.
right?
Yeah.
And so we can have more conversations around that, so then change can happen, because unless things are being talked about, change not gonna happen,
It's not
right? At all. And so, like you said, it's a big elephant in the room, and it's just so tragic that it happened. And, you know, my heart goes out to his family.
Absolutely.
I was shocked.
Absolutely.
I was completely shocked, shook, like, wow. But then I was just thinking, okay, how does this impact the healthcare industry?
Mm-hmm.
And I'm praying for the family.
Mm-hmm.
And we got to get better. And I think we have a solution. It's y'all's show. As you all get comfortable and launch it out. So y'all, they're still working on it. Pray for them. Send them some words of encouragement in their DMs, so that they will know that it's needed. Because seriously, I'm changing. I'm shifting my show a little bit. Like I'm bringing on less guests and bringing back guests that I believe that are impactful.
Impactful.
Right.
Right. So it's like bringing y'all on, bringing my boy Courtney on, who is very big on investing in stock market.
Mm-hmm.
I invested in the ETF and made about $5,000 in about 2 weeks from the
Wow.
ETF. And so it's like these are the kind of people that I want to bring on to the show that are just impactful. That's going to help. By 2050, help us eradicate $1 billion in debt. And if we can lower our insurance bill, our health bill, that's more money we can put towards paying off debt.
Absolutely.
That's more money we can put towards investing. If you invest into the HSA, now we're building. If we can get the right insurance policy, right, even if it is a PPO plan, well, then that helps us with the proper insurance to cover anything major that's coming up, and it prevents us from getting into medical debt.
Right.
So there's this, what you all are offering, what you all are teaching is super, super, super important from a knowledge perspective. And if you're in the DMV and Florida area, from a practical perspective for your family. And so I would encourage you to go check out their information, man. Click the link inside of the show notes, learn more about them, set up a time where you can meet with them if you're in this area. Because like I said, it's affordable if you care about your health. Now, if you don't care about your health, don't even waste your time, because they care about your health more than you. All right. But listen, we got to go. We're way over time. Thank y'all so much. Thank you for coming back on.
Thank you.
We're going to bring them back on next month. We're going to talk about some other things, because I had like 10 other questions, but we're like 45 minutes in, y'all. So we try to keep the show right around 30 minutes, but when it's good information, I don't like rushing it. All right. And so we'll see y'all next show. Peace out.